Have you ever considered that the daily hygiene routines you followed for years might no longer be sufficient as you gracefully age? We are about to uncover 3 often neglected body parts that demand meticulous attention, especially after reaching the age of 70. Neglecting these areas can lead to bothersome infections, irritating rashes, and even serious health complications. If you're watching this video and are ready to unveil these crucial insights, comment daily hygiene right now. Stay tuned until the very end, as we will unveil a surprising region of your body that could be silently undermining your immune system and overall vitality. Understanding this could genuinely revolutionize how you experience each day. Before we dive in, I would be truly grateful if you could hit the like button on this video. Your support helps me continue sharing valuable knowledge about maintaining well-being in your golden years. If you haven't yet subscribed, I highly recommend doing so and activating the notification bell so you don't miss any of our insightful videos. Now, let's embark on this enlightening journey. Number 1. Your feet, the bedrock of your health. Your feet are the unsung champions of your everyday existence. Day in and day out, they stoically bear the entirety of your body's weight, provide unwavering equilibrium, and empower your every movement, whether standing, strolling, jogging, or simply transitioning from one spot to another. They represent the fundamental pillars of your mobility and self-reliance. Yet, for countless individuals, particularly those beyond their 7th decade, meticulous foot care often becomes an afterthought, relegated to a swift rinse during a shower or a perfunctory swipe with a soapy cloth. This oversight, regrettably, can precipitate significant repercussions, as your feet are frequently among the initial anatomical regions to manifest underlying health concerns, particularly as the years accumulate. Proper foot care transcends mere comfort. It serves as a crucial safeguard for your overall health, a steadfast guardian of your autonomy, and an invaluable preserver of your life's caliber. Let's delve into why foot care assumes heightened importance with advancing age. As we mature, our physiological landscape undergoes notable transformations that render the feet particularly susceptible. Diminished circulation, an inherent component of the aging process, translates to reduced blood flow to the extremities, consequently impeding the healing trajectory for even minor abrasions or injuries. The integumentary layer of the feet concurrently attenuates, becoming drier and less resilient, thereby compromising its intrinsic moisture barrier. This desiccation can engender cracks, calluses, or fissures, which, while seemingly inconsequential, can unfortunately serve as ingress points for bacterial, fungal, or other pathogenic microorganisms. Furthermore, the immune system experiences a gradual attenuation with age, rendering the body less adept at combating infections. For older adults, the confluence of these factors transforms the feet into a primary locus for health afflictions that can rapidly escalate if not promptly addressed. For those grappling with chronic ailments such as diabetes, peripheral artery disease, or neuropathy, the associated risks are substantially amplified. Diabetes, for instance, has the potential to induce neural damage known as neuropathy, thereby attenuating sensation in the lower extremities. This implies that even minor cuts, blisters, or nascent infections may elude detection until they reach an advanced stage. Compromised circulation, a common sequela in both diabetes and various vascular conditions, further complicates the healing process, elevating the propensity for severe complications such as ulcers or, in dire circumstances, necessitate amputations. Even for individuals devoid of chronic health conditions, the neglect of proper foot hygiene can engender discomfort, pain, and mobility impairments that gradually erode independence over time. If you're appreciating these insights into foot care, comment foot health below. Now, let's discuss common foot problems and their potential consequences. One of the most pervasive issues afflicting the feet of older adults is fungal infections, notably athlete's foot or tinea pedis. The warm, humid interdigital spaces, juxtaposed with the thinning dermal layer, create an optimal milieu for fungal proliferation. What may initially manifest as mild pruritus, erythema, or desquamation can swiftly progress into more severe pathologies. For example, an untreated case of athlete's foot can pave the way for bacterial infections, such as cellulitis, a potentially grave condition characterized by pronounced swelling, redness, and excruciating pain. In egregious instances, cellulitis may necessitate hospitalization and the administration of intravenous antibiotics. Xerosis, or dry skin, another frequently encountered concern, transcends mere cosmetic implications. As the dermal surface of the heels or soles becomes excessively arid, it can fissure, forming painful lacerations highly prone to infection. These dermal discontinuities may hemorrhage, become inflamed, or evolve into indolent ulcers, particularly in individuals with compromised circulatory systems. For those afflicted with diabetes, even a diminutive lesion can burgeon into a limb-threatening condition if it infiltrates deeper tissues or succumbs to infection. Consider the compelling narrative of Mr. George, a vigorous 75-year-old former carpentry instructor who, for decades, spent countless hours on his feet, imparting woodworking skills and maintaining an active lifestyle. Following his retirement, he began to observe progressive dryness on his heels and a subtle erythema between his toes, occasionally accompanied by mild pruritus. Presuming these manifestations were merely an inherent aspect of the aging process, he unfortunately disregarded the symptoms. Within a month, a minuscule fissure on his heel had tragically transmuted into a debilitating, unyielding ulcer. His physician subsequently diagnosed a bacterial infection originating from untreated xerosis and prescribed a regimen of antibiotics concurrently with custom orthotic footwear to alleviate pressure and facilitate healing. Mr. George's predicament serves as a stark reminder that even minor omissions in foot care can precipitate substantial health challenges. To proactively avert these issues and foster healthy feet, it is imperative to adopt a comprehensive daily foot care regimen that prioritizes meticulous inspection, thorough cleansing, and diligent protection. Herein lies a detailed exposition on nurturing your feet. Commence with daily inspection. Cultivate the habit of scrutinizing your feet each day. Ideally, perform this assessment in the morning before commencing your daily activities or in the evening prior to retiring. Utilize ample illumination and, if necessary, a magnifying mirror to meticulously examine for any evidence of redness, edema, desiccation, fissures, vesicles, lacerations, or alterations in dermal texture or coloration. Direct particular attention to the interdigital spaces, the heels, and the plantar surfaces. Should you encounter difficulties in visualizing or accessing your feet, enlist the assistance of a caregiver, a family member, or a trusted confidant. The early detection of subtle changes can effectively preclude minor issues from metastasizing into formidable problems. If you're committed to daily foot inspection, comment "Vigilant Feet" now. Next, let's talk about thorough cleansing. Washing your feet entails more than a perfunctory rinse during a shower. Utilize lukewarm, not hot, water and a gentle, fragrance-free soap to circumvent irritation. Abrasive soaps or perfumed preparations can divest the skin of its natural emollients, thereby exacerbating xerosis. Employ a soft washcloth, a sponge, or your hands to meticulously cleanse all regions of the feet, encompassing the interdigital spaces, the periungual areas, and along the soles. Should mobility pose an impediment, consider utilizing a long-handled brush or a foot washing implement specifically engineered for enhanced accessibility. Rinse comprehensively to eradicate all soap residue, which, if left behind, can induce irritation. Complete drying is equally paramount as washing. Residual moisture ensnared between the toes or on the soles creates an optimal environment for fungal proliferation. Employ a clean, soft towel to gently pat your feet dry, dedicating particular attention to the spaces between each digit. If reaching proves challenging, a long-handled towel or a hairdryer set to a cool temperature and held at a safe distance can aid in ensuring your feet are entirely desiccant. Under no circumstances should you leave your feet damp, as even a minuscule quantity of residual moisture can engender infections. Moisturizing with meticulous care is the next step. Following thorough drying, apply a fragrance-free, non-greasy moisturizer to the dorsal and plantar surfaces of your feet to preserve dermal suppleness and prevent fissuring. Seek out products containing humectants such as urea, glycerin, or hyaluronic acid, which assist in retaining moisture without occluding pores. Abstain from applying moisturizer between the toes, as this can trap moisture and foster fungal proliferation. Should you be uncertain regarding appropriate product selection, consult a physician or pharmacist for recommendations tailored to your specific dermatological needs. Regarding footwear and sock choices, proper footwear is absolutely indispensable for optimal foot health. Select shoes that provide an accurate fit, furnish ample support, and permit adequate ventilation for your feet. Eschew constrictive or ill-fitting footwear that can induce blisters, calluses, or pressure sores. Alternate your shoes daily to allow them to thoroughly air dry between uses, thereby mitigating the risk of fungal proliferation. Opt for moisture-wicking socks fabricated from natural fibers such as cotton or bamboo, or synthetic blends specifically engineered for breathability. Change socks daily, or more frequently if your feet perspire excessively, and ensure they are impeccably clean and dry prior to donning. If you always choose breathable footwear, comment "Happy Feet" below. Now, let's talk about nail care and professional support. Maintain your toenails trimmed straight across to avert the painful condition of ingrown nails, which are highly susceptible to infection. Utilize impeccably clean and sanitized clippers and exercise caution to avoid cutting too proximally to the skin. Should you experience difficulty in trimming your nails or observe thickened, discolored, or brittle nails indicative of a potential fungal infection, promptly consult a podiatrist. Regular consultations with a foot care specialist can facilitate the judicious management of issues such as corns, calluses, or structural abnormalities that impair mobility. The broader implications of foot care extend beyond the mere prevention of infections or discomfort. It is intrinsically linked to preserving your capacity to lead an active, self-reliant existence. Neglecting your feet can lead to debilitating pain, curtailed mobility, and even social isolation if ambulation becomes arduous. Conversely, a consistent foot care regimen fortifies the very foundation of your daily activities. From executing mundane errands to reveling in a leisurely promenade in the park, it represents a modest investment of time, typically less than 10 minutes daily, that yields profound dividends in terms of health, comfort, and self-assurance. Tomorrow morning, prior to slipping on your preferred shoes or slippers, take a contemplative moment to ask yourself, have I afforded my feet the meticulous care they truly merit? Your feet faithfully convey you through the entirety of your life's journey, and they undeniably warrant more than a perfunctory rinse. They deserve unwavering respect, unwavering attention, and unwavering intention. By prioritizing comprehensive foot care, you are not merely safeguarding your physical well-being. You are meticulously constructing a more robust, more stable bedrock for every endeavor you undertake. If you are still engrossed in this video and finding these lessons invaluable, please take a moment to comment 1 inch below to signify your continued engagement. Thank you for your invaluable time. I believe you're enjoying this video. Before we continue, make sure you subscribe, like, and share this video. Comment "wonderful" if you're enjoying this video. Number 2, the groin area, a stealthy hotspot for infection. Let's move on to the groin area, which is unequivocally one of the most frequently overlooked regions of the body when it pertains to meticulous personal hygiene. This oversight often stems from an understandable sense of embarrassment or discomfort when discussing this intimate zone. Nevertheless, for maturing adults, particularly those beyond their 70th year, this exquisitely sensitive region mandates diligent daily attention to avert issues that can compromise personal comfort, self-assurance, and overarching health. The groin's intrinsically warm, humid milieu, in conjunction with the presence of natural skin folds and potentially diminished mobility, transforms it into a veritable hotbed for irritation, infections, and chronic dermatological conditions. Disregarding this area can precipitate problems that surreptitiously erode one's quality of life. However, with the implementation of appropriate care, you can diligently preserve your dignity, comfort, and overall well-being. If you're ready to learn about proper groin care, comment "private care" now. Now, let's discuss why the groin is particularly susceptible. The groin area possesses a unique vulnerability to hygiene-related issues owing to its distinctive anatomical configuration and environmental characteristics. The presence of cutaneous folds, the inherent warmth, and the pervasive moisture originating from perspiration collectively create an optimal setting for the thriving of bacteria, yeast, and fungi. As we advance in age, several compounding factors exacerbate these inherent risks. Reduced mobility, encompassing limitations in flexibility or difficulty in bending, can render it arduous to meticulously cleanse or thoroughly dry the groin region, thereby leading to entrapped moisture and resultant irritation. Furthermore, the skin undergoes notable alterations with age. It becomes thinner, less elastic, and increasingly prone to laxity, thereby creating deeper folds where sweat and microbial contaminants can readily accumulate. Incontinence, even sporadic urinary leakage, which is a common occurrence among older adults, introduces additional moisture that can compromise the skin's protective barrier. Chronic medical conditions, such as diabetes or obesity, significantly elevate the propensity for infections, as elevated glycemic levels or excess skin folds create highly favorable conditions for accelerated microbial proliferation. Moreover, certain clothing choices and medical devices can contribute to the problem. Constrictive apparel, synthetic fabrics, or absorbent products, such as adult briefs or pads, can effectively trap heat and moisture, exacerbating existing irritation. These synergistic factors can collectively culminate in a spectrum of issues, ranging from mild pruritus to severe infections. One frequently encountered problem is intertrigo, a dermatological condition instigated by skin-on-skin friction in moist areas, resulting in erythematous, excoriated, or inflamed skin. If left unaddressed, intertrigo can progress to the formation of open sores or predispose to secondary bacterial infections. Fungal infections, such as Jock-itch-tinea cruris or candidal overgrowth, are also highly prevalent, inducing intense pruritus, a burning sensation, or a persistent eczematous rash. In severe presentations, these conditions can engender excruciatingly painful lesions that render ambulation, sitting, or even restful slumber profoundly uncomfortable. The repercussions of neglect can be subtle initially. The telltale signs of suboptimal groin hygiene often manifest subtly: a faint, almost imperceptible odor, a slight erythema, or a mild discomfort that is easily dismissed as an unremarkable facet of aging. However, overlooking these nascent warning signals can precipitate significant and often debilitating problems. For instance, a small patch of irritated skin can inexorably develop into a weeping rash or even an overt wound that necessitates weeks of intensive treatment with prescription topical agents or oral antibiotics. For individuals with compromised immune systems or impaired circulation, infections localized to the groin can disseminate, leading to systemic complications of a more profound nature. Consider the poignant case of Miss Margaret, a resilient 82-year-old matriarch who took immense pride in her unwavering independence. She began to observe a persistent, almost unidentifiable odor emanating from her groin region, even after diligent and regular bathing. Mortified, she erroneously attributed it to an inevitable consequence of the aging process and meticulously avoided confiding in anyone. Over time, the odor intensified, accompanied by unrelenting pruritus and considerable discomfort. When she finally mustered the courage to consult a nurse, she received a diagnosis of a mild fungal infection residing within her groin folds, a direct consequence of entrapped moisture, dead skin cells, and microbial proliferation that had regrettably gone unnoticed for several months. With the implementation of a remarkably simple regimen comprising gentle daily cleansing, meticulous drying, and the judicious application of a zinc-based barrier cream, Miss Margaret's symptoms miraculously resolved within a mere few weeks. She later shared, with profound relief, "I had absolutely no idea how significantly this was impacting my mood and my overall energy levels. Addressing it made me feel entirely like myself again." Now, let's explore a comprehensive groin care routine. Preventing groin-related issues necessitates a consistent, gentle, and intentional approach to personal hygiene. Herein lies a step-by-step guide to meticulously caring for this sensitive anatomical region. Begin with daily cleaning. Make the meticulous cleansing of the groin an absolute non-negotiable component of your daily routine. Irrespective of whether you opt for a shower or a sponge bath, always utilize lukewarm, not hot, water and a mild, unscented soap to rigorously avoid irritation. Harsh soaps or perfumed products can irrevocably disrupt the skin's delicate natural balance, ultimately leading to exacerbated dryness or the development of allergenic reactions. Gently cleanse all areas of the groin, meticulously including all skin folds and creases, utilizing either your bare hands or a soft washcloth. Rigorously avoid vigorous scrubbing, as this can inflict irreparable damage to the delicate skin. Rinse thoroughly to ensure the complete removal of all soap residue. Thorough drying is just as important as the cleansing process. Moisture inadvertently left within skin folds serves as a primary instigator of irritation and subsequent infection. Utilize a clean, soft towel to gently pat the entire groin area dry, dedicating particular attention to those areas where skin naturally opposes skin. If your mobility is unfortunately restricted, consider sitting on a sturdy chair or employing a handheld mirror to ensure optimal visibility and accessibility to all regions. A hairdryer, set to a cool temperature and held at a safe and appropriate distance, can prove remarkably beneficial if traditional towel drying presents a significant challenge. Under no circumstances should you ever leave the area damp. Moisture management is critical. If persistent moisture remains despite diligent and thorough drying, apply a minimal quantity of a cornstarch-based powder or a zinc-based barrier cream to adequately protect the delicate skin. These specialized products effectively create a protective epidermal layer that significantly diminishes friction and effectively absorbs any excess moisture. Rigorously avoid talc-based powders, which have unfortunately been linked to various adverse health risks, and assiduously steer clear of any heavily scented products that can predictably irritate sensitive skin. Consult a qualified medical professional or a pharmacist for personalized product recommendations if you remain uncertain. Regarding breathable clothing, always opt for loose-fitting, breathable underwear meticulously crafted from natural fibers such as cotton, or utilize moisture-wicking synthetic blends. Rigorously avoid tight-fitting clothing or synthetic fabrics such as polyester, which inherently trap both heat and perspiration. Change your underwear daily, or even more frequently if you experience excessive perspiration or accidental leakage, and always ensure that it is impeccably clean and completely dry prior to wearing. If you consistently use absorbent products such as briefs or pads, change them with frequent regularity and scrupulously adhere to all hygiene steps to diligently prevent the insidious buildup of moisture. If you prefer breathable clothing, comment airy comfort. Now, daily monitoring is essential. Dedicate a mere 15 to 30 seconds each day to meticulously inspect the groin area for any telltale signs of impending trouble, such as redness, any discernible odor, persistent itching, noticeable scaling, or any subtle changes in your skin's inherent texture. Utilize a handheld mirror, or, if visibility remains an issue, respectfully request assistance. Early detection serves as the absolute cornerstone in preventing minor issues from relentlessly escalating. If you unequivocally notice any persistent symptoms or anything at all that appears unusual or atypical, consult a qualified healthcare provider with utmost promptness. Physicians and nurses are highly accustomed to addressing these concerns and can readily provide targeted treatments, such as potent antifungal creams or appropriate antibiotics, to expeditiously resolve any issues. The broader impact of proper groin care extends far beyond the mere prevention of localized infections or unpleasant odors. It is intrinsically about diligently preserving your fundamental comfort, your inherent confidence, and your unwavering dignity. Unresolved discomfort in the groin can profoundly affect your intrinsic ability to move with unrestricted freedom, to achieve restorative sleep, or to confidently engage in various social activities, ultimately leading to profound frustration or debilitating embarrassment. By stark contrast, the implementation of a remarkably simple daily routine can profoundly restore your innate sense of self and diligently prevent issues that might otherwise catastrophically disrupt your precious life. The groin may undeniably represent a private anatomical region, but its pervasive impact on your overall well-being is undeniably profound. Meticulously caring for your groin is an intrinsic act of profound self-respect, not merely an act of superficial vanity. It is a resolute commitment to diligently protecting your health, your unrestricted mobility, and your deeply ingrained emotional well-being. In just a paltry few minutes each day, you can definitively prevent discomfort and assiduously maintain the unwavering confidence that inherently accompanies feeling impeccably clean and profoundly comfortable. The next time you are engaged in the act of freshening up, take a poignant moment to remember that the groin is emphatically not an optional component of your comprehensive hygiene routine. It is, in fact, a core and unwavering pillar of your overarching health. Invest those precious few minutes, and you will unequivocally reap the profound rewards of a life that is demonstrably more comfortable, profoundly more confident, and vibrantly more alive. If you are still watching this video and diligently finding these lessons useful, please comment "freshening up" below to unequivocally let me know that you are still watching this video with me. Thank you for your invaluable time. Number 3. The navel area, a hidden pocket deserving daily care. Now, let us meticulously shift our focus to an often disregarded anatomical region, frequently dismissed as utterly insignificant, yet quietly pivotal to your overarching health: the navel, commonly known as the belly button. This diminutive, unassuming indentation centrally located on your abdomen might, at first glance, appear to warrant minimal consideration. After all, it is merely a minuscule vestige from your umbilical cord, is it not? However, here lies a surprising reality that absolutely demands your focused attention. If left neglected, the navel can regrettably evolve into one of the human body's most problematic areas, particularly for seniors beyond their 70th year. Without the implementation of appropriate care, this frequently overlooked anatomical pocket possesses the insidious potential to harbor bacteria, yeast, and various forms of detritus, ultimately leading to localized irritation, overt infections, and even more pervasive, systemic health complications. Let us delve into a comprehensive exploration of why this phenomenon occurs, why its significance is often underestimated, and, crucially, how to meticulously care for this hidden area with the unwavering diligence it profoundly merits. If you're surprised by the importance of navel hygiene, comment belly button care. Now, let's explore why the navel holds more significance than you might intuitively perceive. The navel transcends the simplistic designation of a mere anatomical idiosyncrasy. It functions as a recessed, inherently warm, and frequently moist concavity that possesses a natural proclivity to accumulate an eclectic array of debris, including perspiration, desiccated skin cells, textile lint from clothing, residual soap, and microscopic particulate matter. For a multitude of individuals, the prevalent assumption is that a perfunctory rinse during a showering ritual suffices to maintain its cleanliness. However, the navel's distinctive morphological structure, a convoluted crevice adept at ensnaring both moisture and detritus, renders it an optimal nidus for the proliferation of bacteria and yeast if not meticulously maintained. This intrinsic vulnerability is particularly pronounced in seniors, whose skin and immunological systems undergo physiological metamorphoses that invariably augment susceptibility. As we traverse the trajectory of aging, several compounding factors amplify the navel's inherent susceptibility to various dermatological challenges. For instance, the skin surrounding the midsection, particularly after the age of 70, often exhibits a diminished tautness, and the abdominal wall itself may experience a subtle softening or weakening. This physiological transformation can result in a more deeply recessed or intricately folded navel, thereby inadvertently creating an ideal microenvironment for the insidious accumulation of moisture and particulate matter. Furthermore, the immune system experiences a gradual attenuation with advancing age, rendering the body less proficient at mounting an effective defense against infections, even those of a seemingly minor nature. Consequently, a nascent bacterial or yeast buildup within the navel can regrettably escalate into a more formidable issue. Mobility challenges also play a significant role. For a considerable number of seniors, the physical act of bending over or extending to meticulously cleanse the navel becomes physically demanding. As a direct consequence, this area is frequently either intentionally omitted or, at best, superficially rinsed. Moreover, pre-existing health conditions, such as diabetes, obesity, or compromised circulation, all of which are prevalent among older adults, can demonstrably exacerbate the risk of developing infections in inherently warm, moist anatomical regions like the navel. Individuals with a historical antecedent of abdominal surgeries or prior navel piercings confront supplementary risks, as scar tissue or remnants of old piercing tracts can regrettably entrap bacteria for extended durations before precipitating overt symptomatic manifestations. Now, let's discuss the subtle warning signs. The neglect of the navel does not invariably herald its presence with dramatic and unmistakable symptoms. In fact, the insidious signs of impending trouble frequently commence imperceptibly, rendering them remarkably easy to overlook. A faint, almost imperceptible musty odor emanating from the navel often serves as the inaugural clue that something is amiss. Mild redness or a subtle pruritus localized around the navel may be erroneously attributed to superficial dry skin or transient irritation stemming from clothing. A persistent sticky or moist sensation, occasionally accompanied by a scant amount of discharge, unequivocally signals that a robust population of bacteria or yeast may be thriving within the navel. Lingering itching or soreness, characterized by persistent discomfort that steadfastly refuses to dissipate with a perfunctory rinse, constitutes a definitive red flag. If these subtle, yet crucial, symptoms are regrettably ignored, they possess the capacity to escalate into omphalitis, the precise medical nomenclature for inflammation or overt infection of the navel. In the senior demographic, omphalitis can prove particularly recalcitrant to therapeutic intervention owing to decelerated dermal regeneration and a physiologically weakened immune response. What commences as a minor irritation could regrettably necessitate weeks of protracted healing, requiring the diligent application of topical or systemic pharmacological agents and possessing the potential to disrupt daily comfort significantly. If you're recognizing these subtle cues, comment "early detection" below. Let's consider a compelling real-life example. Peter's story. Ponder the poignant case of Mr. Peter, a meticulous 79-year-old retiree renowned for his unwavering commitment to impeccable personal hygiene. Mr. Peter rigorously showered daily, maintained his coiffure with fastidious neatness, and invariably donned immaculately polished footwear. Yet he began to discern a persistent and bothersome pruritus localized around his navel, which he initially ascribed to superficial dry skin or frictional irritation from his waistband. Over an indeterminate period, the pruritus inexorably worsened, and one morning his diligent daughter, while assisting him with dressing, detected a faint, distinct musty odor emanating from the area. A subsequent consultation with his physician unequivocally revealed a candida infection within his navel, unequivocally caused by a protracted accumulation of moisture, desiccated skin cells, and microbial contaminants that had, regrettably, gone unnoticed for several months. Peter's compelling narrative serves as a potent reminder that even the most conscientiously diligent individuals can inadvertently overlook this diminutive, yet critically important, anatomical region. Why does the navel matter even more after 70? The navel's inherent vulnerability is undeniably augmented with advancing age due to a confluence of several compelling reasons. The aging skin, for instance, exhibits a thinner epidermal layer, diminished elasticity, and a heightened propensity for moisture retention, particularly within recessed anatomical areas like the navel. Furthermore, as the abdominal muscles gradually attenuate, the navel can progressively deepen or develop intricate folds, thereby inadvertently trapping an increased quantity of debris and moisture. Health and lifestyle factors also contribute significantly. Seniors grappling with diabetes, obesity, or curtailed mobility are demonstrably at a heightened risk for developing infections in inherently warm, moist anatomical regions. Individuals who maintain prolonged sedentary postures or habitually wear constrictive clothing may inadvertently exacerbate the insidious buildup of moisture. Lastly, reduced self-care capabilities, such as the onset of debilitating arthritis or a reduction in intrinsic flexibility, can render it remarkably arduous to meticulously cleanse the navel, thereby leading to inadvertent neglect. Now, let's delve into how to care for your navel, a comprehensive step-by-step guide. Proper navel care unequivocally necessitates neither an exorbitant investment of time nor a prodigious expenditure of effort. However, it indisputably demands unwavering intention and consistent adherence. Herein lies a detailed guide to meticulously maintaining the cleanliness and robust health of this often hidden anatomical region. During your daily bathing ritual or sponge wash, embark on the cleansing process gently yet thoroughly. Utilize a cotton swab, the corner of a soft washcloth, or a clean fingertip. Immerse your chosen implement in warm water judiciously mixed with a mild, fragrance-free soap. Abrasive soaps, it is imperative to note, possess the potential to irritate sensitive skin. Gently insert the swab or cloth into the navel and meticulously swab the interior, rotating carefully to meticulously remove any accumulated lint, perspiration, or other forms of detritus. Rigorously avoid probing excessively deeply or scrubbing aggressively, as this can inflict damage upon the delicate skin. Following cleansing, meticulously rinse the navel thoroughly with a clean, damp cloth to eradicate any residual soap, which itself can act as an irritant if left behind. Dry the area with meticulous precision, employing a clean, dry cotton pad, a fresh tissue, or the corner of a soft towel. Even a minuscule quantity of residual moisture possesses the capacity to create a conducive microenvironment for robust microbial proliferation. Consider judiciously utilizing a hairdryer set to a cool, low setting for areas that prove challenging to access, particularly for individuals possessing deeper navels. If you always dry your navel thoroughly, comment dry and clean. Now, monitor diligently for any warning signs. Regularly inspect your navel for any discernible redness, any palpable swelling, any abnormal discharge, or any pronounced odor. It should consistently feel impeccably clean, thoroughly dry, and entirely devoid of soreness or stickiness. Should you unequivocally observe any persistent symptoms or anything at all that appears unusual or atypical, consult a qualified healthcare provider with utmost promptness. Early intervention can definitively prevent minor issues from relentlessly escalating into serious infections. Adjust your routine for deeper navels. If your navel is particularly deep or exhibits pronounced folds, a common characteristic in seniors or individuals with a higher body mass index, consider cleansing it twice daily, especially during periods of elevated ambient temperature or humidity when perspiration tends to accumulate. Opt for loose-fitting, breathable clothing meticulously crafted from natural fibers such as cotton to assiduously reduce both moisture buildup and frictional irritation. Crucially, never ignore pain or discharge. The presence of pain, localized swelling, or any form of discharge, particularly if it is foul-smelling or discolored, constitutes unequivocal signs of infection that demand immediate medical attention. Seniors afflicted with diabetes, compromised circulation, or a historical antecedent of abdominal surgery or body piercings are demonstrably at a heightened risk for complications. Do not, under any circumstances, dismiss these symptoms as normal or passively await their spontaneous resolution. The broader implications, why navel care matters. Envision your navel as a diminutive, often hidden storage space within your dwelling. You do not access it with daily regularity, but if it remains perpetually uncleansed, dust, grime, and disarray accumulate silently and insidiously. Over a protracted period, this gradual accumulation creates an uncomfortable and increasingly challenging mess to rectify. Similarly, neglecting your navel permits the insidious accumulation of bacteria, yeast, and various forms of detritus, possessing the inherent potential to culminate in infections that irrevocably sap your energy, your intrinsic comfort, and your unwavering confidence. Diligent daily navel care represents a modest, yet profoundly potent act of preventive health. It is not an endeavor driven by superficial vanity or an excess of zealous hygiene. Rather, it is fundamentally about meticulously protecting your skin, assiduously supporting your immune system, and diligently preventing minor issues from metamorphosing into major disruptions. A meticulously clean navel translates directly into clothing that feels fresher, a reduction in the incidence of irritating skin conditions, and a significantly diminished risk of developing infections that could potentially necessitate weeks of protracted medical treatment. Most importantly, it constitutes an intrinsic act of profound self-respect, a quiet and unwavering acknowledgement that every constituent part of your physical being, irrespective of its perceived diminutive size, profoundly merits unwavering care. If you are still watching this video and finding these lessons genuinely useful, please comment 3 inches below to unequivocally indicate your continued engagement with me. Thank you for your invaluable time. What these 3 body parts reveal about your health. The feet, groin, and navel are far more than mere anatomical regions requiring perfunctory cleansing. They serve as your body's intrinsic early warning systems. These often overlooked areas subtly yet powerfully signal how your physiological system is adeptly or maladaptively navigating the intricate landscape of stress, the inexorable march of aging, or the delicate equilibrium of microbial populations. For individuals traversing their 60s, 70s, 80s, and beyond, dedicating meticulous attention to these specific areas assumes an even more paramount significance as the skin, the immune system, and overall mobility undergo inevitable age-related transformations. Let's succinctly recapitulate the salient lessons garnered from our comprehensive discussion of these 3 critical anatomical regions. Your feet, the steadfast foundation of your daily life, are far more than mere conduits of locomotion. They are intricate barometers of your circulatory health and overall systemic well-being. Neglecting these vital structures can lead to debilitating pain, insidious infections, and a profound erosion of your cherished independence. Daily inspection, thorough cleansing, and diligent moisturizing are not optional luxuries, but fundamental necessities for preserving your mobility and preventing serious complications. The groin area, a sensitive and frequently overlooked region, represents a nexus where hygiene directly intersects with personal dignity. Its inherent warmth, pervasive moisture, and frictional dynamics create an ideal milieu for microbial proliferation, particularly for seniors who may experience prolonged periods of sitting, wear restrictive clothing, or manage the challenges of incontinence. Scrupulous cleaning and meticulous drying are indispensable for maintaining dermal integrity, fostering unencumbered mobility, and reinforcing an invaluable sense of personal confidence. The navel, arguably the most consistently forgotten anatomical pocket, possesses an alarming propensity for bacterial and yeast accumulation if not intentionally and systematically cleansed. A remarkably brief, focused daily routine, encompassing gentle cleansing and comprehensive drying, can effectively avert infections like ontholitis, thereby sparing you weeks of considerable discomfort or the necessity of pharmaceutical interventions. The deeper message inherent in our discussion is that small acts can yield profoundly significant impacts. The journey of aging gracefully is not characterized by grandiose gestures, exorbitantly priced treatments, or drastic lifestyle overhauls. Rather, it is meticulously defined by a succession of small, consistent acts of self-care that honor your body's evolving needs. The conscientious daily cleansing of these three crucial areas, your feet, your groin, and your navel, demands merely a few minutes of your valuable time, yet it yields profoundly beneficial dividends. This routine significantly reduces the incidence of skin issues, including bothersome rashes, insidious infections, and persistent irritation, thereby ensuring your skin remains comfortable and robustly healthy. Enhanced comfort is an immediate benefit. Clean, thoroughly dry skin in these sensitive regions translates directly into diminished friction, reduced itching, and an overall absence of discomfort, empowering you to move and rest with effortless ease. Furthermore, a consistent commitment to caring for these often hidden areas significantly boosts your intrinsic confidence, fostering a profound sense of personal control and self-respect, serving as a powerful reminder that you are unequivocally worth the effort. Lastly, this diligent approach to hygiene constitutes a potent form of preventive health. By proactively addressing these specific areas, you substantially mitigate the risk of developing infections that can insidiously drain your energy or necessitate disruptive medical interventions. Seniors who conscientiously prioritize these seemingly minor routines frequently report superior skin health, fewer unscheduled doctor visits, and a more profound connection to their physical selves. They consistently feel fresher, move with greater comfort and fluidity, and achieve more restorative sleep, liberated from the nagging itch or the persistent odor that can originate from a single, neglected spot. Most importantly, they embody a quiet yet unwavering resilience, a resolute refusal to permit the natural progression of age to diminish their steadfast commitment to feeling profoundly good. Thank you for joining us on this enlightening exploration of three often overlooked body parts that undeniably play an immense role in your overall health and personal comfort as you gracefully age. By conscientiously affording your feet, your groin, and your navel the meticulous care they profoundly merit, you are not merely averting discomfort. You are actively safeguarding your mobility, fiercely preserving your confidence, and diligently protecting your overall well-being. What have you learned today that surprised you the most? We encourage you to share your insights in the comments below. And before you click away, don't forget to subscribe, like, and share this video with your friends and family. We have many other interesting and sensational videos on this channel that could further enhance your journey to a vibrant and fulfilling life. We urge you to explore them and continue learning.